All right, now we're going to look at lower back. Well, lower back and obviously probably the top of the pelvis. Now, if we're talking about kids and lower back, if we're not talking about activity in sport, then we're going to be talking about, unfortunately, the sitting position at school. And look, let's just face it, that can end up being a real pain in the bum. And I do see a lot of kids for lower back stiffness and soreness, as well as neck pain as well. But the lower back soreness for us, and especially for mums and dads out there, there is a lot of massage that you can do that will be really beneficial for this as well. So let's just break it up. Obviously, we have the glutes that come around the top of the hips. We have the long chain of muscles that come all the way down there. They're called our erector spinae muscles, okay? In that area where your ribs finish and your lower back joins together, that's what we call the thoracolumbar. I know it sounds like a big word, but it just means a junction between 2 points in the region of the bodies. This is an area where we get a lot of what we call little trigger points that develop, so they can be really basically quite sore, and they can refer pain down into here as well. So this is a bit of a focus area for us as well. Now, in terms of how we address this and how we can massage this, especially for kids that have been sitting in that stoop position for long periods of the time, pretty simple. We're going to use the arnica because it's got really great healing qualities, and once again, it's the texture not unlike the Premax Essentials. So we're going to work like this. We're going to come down towards the pelvis itself, okay, once again using broad hand across atop what we call the gluteal muscles, okay. We're going to wrap around the top of the hip and then back up again, okay. So but we're starting basically right up here past where we call this thoracolumbar junction. So where you feel the fleshy part where the last rib is, okay, if you follow that last rib up, that little area there is our thoracolumbar. So that's where these little tender spots start to develop, okay? So we're going to come down across those, and then we can come across, back up, and back around again, okay? So it's like a one big sweep, almost half a figure eight, if you like, okay? We make it broad, so once again we've got hand on top of hand, across like so, and then back up. And you're not fighting against any tissue here, that's the benefit, okay? Whereas sometimes if you go in certain directions, you fight against the muscles, okay? Whereas this, you're going to be working with the fibres and across the fibres as well, okay? So we're going down with the fibres of the erector spinae, okay? And across over the gluteals, and then sweep up and back. Now, obviously in this area here for our therapist, that's where the quadratus lumborum, so that you can address that area, but we're not going to do that today because we're just looking at doing more general principles. Now, when we come down here, we're at that thoracolumbar. So what we can do is we can just work backwards and forwards, just really broadly over that, what I call that thoracolumbar junction. Okay, that's where these tender spots are. And what we can also do, bring the table up, come down and just focus into those areas and just do little stripping motions through that area. Now, it's not unusual. Sometimes you might actually get some pain referring down into the pelvis itself from these areas here, okay? So once again, watch your pressure. We don't need to go super deep or super hard. So we're doing it just the right pressure here for Zara because she's not contracting against me, she's not wincing, she's not yelling, and she's not hitting me, so that's great. So that way I know I'm working with the tissue. Okay, so we're working across those gluteals. Now, as we work across these gluteals, there are a couple of little trigger points that develop through here as well. So once again, this is an area where we can just focus and do small little strokes through those trigger point areas as well, okay? And then we come back out, a little bit more, and a little bit more, and a little bit more, okay? And then we come back up, sweep around, back up again, and then down, okay? Now, you're gonna ask, how long do we do this for? Once again, you know, like a 5 to 10 minutes will be enough. Obviously, this is what I do all day, every day, so I can do this for a good 35, 60 minutes. For those of you out there that don't do this, then you obviously need to be aware that you're probably not gonna have the endurance, strength, and stability to be able to do a lot of this. So about 5 or 10 minutes will be fine. You can do a little bit of this each night. This is the same with a lot of your athletes, your running athletes as well, because they'll get really stiff and sore through this area as well. God forbid if you've got jumping athletes, okay? So if your kids are out there doing jumping, like whether it be netball, basketball, any of those sort of sports where there's a jumping or even high jump, then obviously this is a really key area as well. Okay, so just remember those principles: down, across, and back up. Okay, once again, I go through a lot of these areas here on my website, stuarthinds.com, in terms of the blog. So if you want to jump on there and have a look at those as well, obviously with the premax.co, with our blogs as well on there. So we cover a whole range of sort of stuff that relates, in and out of working just generally with massage. I hope you enjoyed it, and we look forward to hearing your feedback. And as usual, I love this last bit. Don't forget to subscribe to this channel below. Click subscribe, and don't forget to check out premax.co and obviously stuarthinds.com.
So if you even remotely enjoyed some of that content, please do me a favor and hit the like button below, just so that I know that you did enjoy it. Also, if you don't want to miss out on any of the content that we put up on a regular basis, then the best way to do that is obviously just to hit the subscribe button. So it's a bit of a no-brainer. But most importantly, if you really want to see the true show, the real show, take the opportunity, hit the link below, stuarthinds.com. That's where we have all the comprehensive assessment, treatment of a whole range of conditions. That's where we have our online courses and obviously our mentoring and so forth, the webinars and our podcasts. So if you're even remotely interested in what we do, go and check it out. Appreciate it. But also, most importantly, again, just be awesome at what you do.